Internal carotid artery. I use this picture from famous Atlas of Anatomy of Finnish. This detailed picture demonstrates smallest branches of internal carotid artery and topography of it. In lower part of this picture, we can see that skull or head was cut sagittally. We can see here internal carotid artery, external carotid artery, and this part of internal carotid artery practically is hidden inside of the skull, and in upper right part of this picture it is enlarged from this small size to another magnified size. And now let's try to understand this part of enlarged picture and to draw it together. So, parts of internal carotid artery. We shall draw together, use a whole page in your notebooks to draw all the details. So, let's begin. Here it is. We can see here that internal carotid artery is quite complicated according to directions of its passing during the canal, Canalis carotidus, and after it. It's very interesting that first part of internal carotid artery, cervical part, it is quite long but without any branches. It's very interestingly that internal carotid artery has no one branch in cervical part. We remember that internal carotid artery originates from common carotid artery at the level of hyoid bone, and it elevates to the basis of the skull at least 7 or 10 centimeters. It depends from the length, from the height of the person, and then it shall enters here in this foramen caroticum externum. So up to this foramen caroticum externum, most lower part of our picture is Parse cervicalis, Arteria carotis interna. So I designate it as letter A, foramen caroticum externum. Let's try to find it on our specimen. Here it is, foramen caroticum externum. So before this part, that was cervical part of Arteria carotis interna, and here begins another part. And now let's return to our picture. Now we use designation of letter B, foramen caroticum internum, and it's clear that this part is flexioned. It is in practically right angle according to the pars cervicalis, so it's turned in right angle and passes inside of temporal bone. This is pars petrosa. Before foramen caroticum internum, from foramen caroticum externum, this small part, about 1 centimeter in length, is situated inside of temporal bone. And then we can find another designation, letter C. What is it? It's border between next part. Next part is so named Parse Cavernosa. After leaving Canalis caroticus, Arteria carotis interna again make this flex, and this part, pars cavernosa, is the next part with the border which we can name as clinaidus proces of ale minoris. Let's try to find them. Now I use the internal basis of the skull. Here it is, foramen caroticum internum. Here finished pars petrosa, and next part, about 2 centimeters here, passes on the side of Turcic saddle, here in sulcus caroticus, and the finishing border of this pars cavernosa is this structure. What is it? What is it? What is it? It's processus clinaidus posterior of ale minoris. It's ale minor, and this is processus clinaidus posterior. So when the artery contacts with processus clinaidus posterior, we can say that pars cavernosa of arteria carotis interna is finished. And let's return. Then more superiorly will be pars cerebralis. Pars cerebralis. Pars cerebralis we can find already on the brain. Practically in our rubber brain we can find this vessel. Here it is. Here it is. It's arteria carotis interna. It's pars cerebralis. Pars cerebralis of arteria carotis interna. Then we can find its finishing branches, but this trunk is last part of arteria carotis interna as a distinct vessel inside of the skull. So let's return to our presentation. So we can find that arteria carotis interna has 4 parts: pars cervicalis, pars petrosa, pars cavernosa, and pars cerebralis. And now let us try to find branches of each pars. First of all, pars petrosa. But we already have said that there is no one branch in pars cervicalis. There is no one branch in pars cervicalis. The first branches we can find only in pars petrosa. So I colorize pars petrosa, and first small branch, number 1, is designated as rami carotico-tympanici. Rami carotico-tympanici. Now I use the temporal bone. You can remember it and demonstrate you the main structures: fossa jugularis, here it is, and foramen caroticum externum. Foramen caroticum externum then prolongates into canalis caroticus, and here inside of it there is very small dots. What is it? It's small foramine for these vessels. So canaliculi carotico-tympanici, these small foramine, which is less than 1 millimeter, but they are crucial for blood supplying of temporal bone and tympanic cavity as well. So these very small dots, very small canaliculi carotico-tympanici, they serves as a small canaliculi for these vessels: rami carotico-tympanici, arteria carotis interna. Let's return to our scheme. And now more large vessel, number 2. What is it? It's Canalis pterygoidus, Arteria canalis pterygoidus. Again, to find it, we shall return to our specimen. I want to remember this sphenoidal bone. Now we are watching from dorsal aspect. This is pterygoid process, and on the basis of pterygoid process we can find this. Here it is, this canal, Canalis pterygoidus. So inside of this pterygoid canal, Canalis pterygoidus, we can find this vessel, Arteria canalis pterygoide. And I use also natural specimen. Here it is, Arteria canalis pterygoidus, where inside we can find Arteria canalis pterygoide. Okay, let's return to our picture. So in this Parse Petrosa, we have found only 2 vessels, 2 branches. And now next part, Parse cavernosa. This cavernous part is quite complicated according to its topography, and it has several extremely important branches. First of all, we use these large branches, number 3, Arteria tentori, which supplies tentorium cerebelli. And then number 4, the same function, they are rami meningialis. Practically these 2 types of vessels, Arteria tentori and rami meningialis, they are similar to each other, but directions are different. Then number 5, Arteria or ramus ganglia trigeminale. You remember that trigeminal nerve has large afferent ganglion, sensory ganglion, which, because it's quite large, are needed to be supplied with arterial blood. So number 5 serve for this blood supply of trigeminal nerve. And more superiorly, the same part of cavernous region prolongates into next cerebral part. And in cerebral part, first large vessel, number 6, we use. This number 6, here it is, vessel is arteria ophthalmica. We can say that it's first large branch of cerebral part. Large, but the diameter of this vessel is about 2 and sometimes 2.5 millimeters. So we says we say large branch, but it's large in comparison with this very smallest arteria of previous regions. So arteria ophthalmica, and then in opposite direction from it we can find number 7, arteria hypophysealis superior. Arteria hypophysealis superior. You remember that hypophysis is one of the very important organs of internal secretion, which is located inside of the Turkish saddle of sphenoid bone. And this very small internal gland has several arterial blood vessels. And one of them, number 7, is arteria hypophysealis superior. Why it's necessary several blood vessels? Because of providing independence blood supply, independent blood supply. And now we use designation number 8. Here it is. Number 8 is arteria communicans posterior. Here it is, arteria communicans posterior. And also excuse me, it's mistake. Arteria communicans anterior. Excuse me. We shall change this material later. Arteria communicans anterior, and number 9, arteria chariaida anterior. Arteria chariaida anterior. So practically we finished this scheme, and now let's try to distinguish and summarize the most important principles. First of all, cervical part has no any vessels. Pars petrosa has 2 vessels, rami carotica tympanici and arteria canalis pterygoidus. Third, pars cavernosa has vessels especially for meninges and ganglion trigeminale. And fourth, pars cerebralis has number 6, arteria ophthalmica for eyeball, and number 7, arteria hypophysealis superior, very independent vessel from arteria carotis externa. And then communicans anterior and chariaid anterior number. 8 and number 9. And now let's try to more detailed analyze this region, Parse cavernosa. So next slide, Parse cavernosa of internal carotid artery. I use this picture from Lippert textbook of anatomy. This is German famous textbook. And what is seen here? It's Turkish saddle. This is sulcus chiasmatis, and number 4 is chiasma opticum. Chiasma opticum is place where left and right optic nerves, they mixed, they contacts with each other and partially change the direction of the fibers from one eyeball to another part of the brain. And number 8, Arteria carotis interna. So Arteria carotis interna, you can see it was cutted here when brain was removed from the basis of the skull. So it was necessary to cut Arteria carotis interna. So another part of Arteria carotis interna will be on the brain. Please remember this picture. We shall find now on the specimen those parts of the Arteria carotis interna which was cutted here. So one part is on this picture, and now we shall use this specimen. So another part is here. Here. It means that when the brain was removed, one part of vessel was in the Turkish saddle and another here on the brain. So I want to demonstrate that. That was like this. And to remove the brain, we need to cut this vessel. We need to cut this vessel, Arteria carotis interna, Arteria carotis interna, and part of it will be on the brain, and another part will be here. Will be here. Let's remember, what is it? It's dorsum sella, the back of the Turkish saddle. This is fossa hypophysalis. Inside of it, the hypophyses take place. Very small organ of internal secretion. Here it is, sulcus chiasmatis. Here we can find chiasma opticum. And here it is, sulcus caroticus, where cavernous part of internal carotid artery take place. with this blue line, cavernous sinus is depicted, but it's only schematically, because really this sinus is not simple venous vessel, but it is a large of anastomotic small vessels which contact with each other, and they surround artery which are inside of it. So now we shall cut the skull in this plane, transversal plane, and we shall find this region in the same picture. We shall return to the same picture, and please try to remember the specimen when we shall watch the our picture. So again, this is sulcus chiasmatic and chiasma opticum, and this is number 1. It's hypophysis, and more deeply, it's corpus of sphenoid bone, and inside of it, this air-containing region, it's sinus sphenoidale. It's paired, this is left, this is right, sinus sphenoidalis, and between of them there is an internal wall. And number 9 is sinus cavernosus. So what is it, sinus cavernosus? It's very interesting venous venous structure which consists of numerous, here they are, small anastomosing vessels which surround Arteria carotis interna, number 8. So Arteria carotis interna is inside of this sinus. So where is a blue color, the venous blood flows, and where is red color, inside of internal carotid artery, here arterial blood flows. So they flows in different directions. And again, sinus sphenoidalis, number 6. Now, from Arteria carotis interna, in this cerebral part, so that was cavernous part, and this is cerebral part. From it, number 7, Arteria ophthalmica branching. Number 7 is Arteria ophthalmica. I use this picture by 2 reasons. One of them, for we can understand how small this region is. We have magnification in this picture maybe in 20 times in comparison with a real size of this region. And without a special picture, it's impossible to understand where we are. And second reason is because this picture is obligatory for your test which you shall pass in India when you 5 years later will have your test for having certification for practical work. So this is very important obligatory picture. That's why I have demonstrated it to you. And now another picture, the same practically region, but from another aspect, from superior aspect. Do you remember that in previous picture we used frontal section, and here practically no one section we can see the anterior fossa, cerebral fossa of the skull, of basis of the skull. Here was partially removed the superior wall of the orbit, and that's why we can see the eyeball with nerves, muscles, and here part of the cerebral, middle cerebral fossa, and here again the sella turcica, Turkish saddle, and there is no hypophysis is depicted, but we can see the small foramen through which the hypophysis enters to the Turkish saddle. And what is this? It's trigeminal ganglion, trigeminal nerve and trigeminal ganglion. And this is optic nerve. And now I shall demonstrate it on the specimen for comparison. So we watch this area, this part of superior wall of the orbit was removed. That's why we have seen the eyeball, and this is the Turkish saddle, and these blue vessels are the same like in picture. So for comparison with the previous picture, I'd like to use this this paper to demonstrate the plane in which previous picture were made. In this frontal plane we have carotid in previous picture, but in picture which we shall study now, we see only from above and have removed upper wall of orbit to see freely the eyeball. So let's return to our picture. So here it is, upper aspect. superior aspect with removed partially the superior wall of the orbit. So what we can find here, first of all, Parse cavernosa, Arteria carotis interna. Here it is. So this part which is lying inside of sulcus caroticus. From lateral side of Turkish saddle, you remember sulcus caroticus, that means inside of it is located Parse cavernosa, Arteria carotis interna. And Arteria carotis interna is surrounded by Sinus cavernosus. Sinus cavernosus is a numerous venous vessels which covering Arteria carotis interna inside of it. And what else can we find? What is it? It's sinus intercavernosus. So between right and left sinus cavernosus, there is anastomosis, sinus intercavernosus, for making equal blood supplying on both sides, in right and left. And now I'd like to demonstrate you that pars cerebralis of Arteria carotis interna is on the place where processus clinaeidus posterior were located. It's here. It is were removed when they opened the orbit. So processus clinaeidus was removed. We can see this removed part of ala minor just here. So this is pars cavernosa, Arteria carotis interna, and after this turning, this is pars cerebralis. And from pars cerebralis, we can find Arteria ophthalmica, this large vessel, relatively large, about 2.5 millimeters in diameter, and it will supply the eyeball with numerous branches. And from it, from Arteria ophthalmica, we can find very small vessel, very small. It's really small, much less than 1 millimeter. It's Arteria centralis retina. Inside of optic nerve, it enters the optic nerve and it passes inside of optic nerve into the retina of eyeball. And ophthalmologist can see this vessel during ophthalmoscopy, during the watching the internal surface of eyeball through the pupil in dark room. You know, this procedure take place when in room is dark. It's interesting that walls in this room also black. They color walls of the room in black, and doctors enlight the internal surface of the eyeball through pupil using a special source of light. a special lamp, and simultaneously watching the retina on the back wall of eyeball through this through the pupil. And Arteria centralis retina is very important and informative science for ophthalmologists when they use it for understanding the condition both of the brain and condition of brain vessels. So it's possible to see this vessel, Arteria centralis retina, in each living person in this special investigation, which called ophthalmoscopy. So in dark room with using a special artificial light through watching the retina on back wall of eyeball. So this picture, I hope, can help us to find the relationships between small branches of Arteria carotis interna in cavernous part and in cerebral part. And now let's try to look at the branches of internal carotid artery in this scheme. So practically, this part of vessels called as circle of Willis, in Russian Willisiv kруг, circle of Willis, like Bruce Willis, but that was another Willis. And where can we find it? I try to demonstrate here that one of these vessels we can see here, we can cut the mesencephalon, and in this situation we can find the anastomotic ring on the basis of the brain. So let's return to our scheme and here let's try to make detailization. We shall use this square and to make enlargement of it. So this part, we enlarge it for such detailed picture. And let's try to distinguish each of vessels. First of all, here it is. First vessel with this arrow. What is it? Number 1. It's Arteria ophthalmica. It's Arteria ophthalmica. You can recognize that this is Arteria carotis interna, Parse cerebralis, those which was cut it and removed together with the brain, and first vessel, first branch of cerebral part is here, number 1, Arteria ophthalmica. Then in another direction. Number 2 is Arteria hypophysalis superior. We already have seen this vessel in another picture. They are directed in different direction. Ophthalmica anteriorly and hypophysalis superior medially and posteriorly. And now I use another picture to demonstrate the relationships between these vessels and hypophysis. If here hypophysis was removed, we didn't designated it here, but this picture differ from upper due to we can find here nervus opticus, chiasma opticum, tractus opticus, and hypophysis. So for us, it's easy to understand that vessel number 2, Arteria hypophysalis superior, it's here. It's here. Arteria hypophysalis superior. And then we can find vessel number 3. Vessel number 3 is Arteria hypophysalis inferior. Arteria hypophysalis inferior. Here it is. Arteria hypophysalis inferior. Here it is on the left down picture. Arteria hypophysalis inferior. They're very small, but very important. And now, number 4, here it is. Number 4 is Arteria hypothalamica. It supplies hypothalamus with arterial blood. And this large vessel, number 5, is Arteria choroida anterior. I hope you remember that inside of the brain there is lateral ventricles, and inside of lateral ventricles we can find plexus choroidus, and plexus choroidus supplies arterially with Arteria choroida anterior. So it passes inside of lateral ventricles, and lateral ventricle from right and from left side, and supplies it. And now this large vessel number 6 here, it's Arteria communicans posterior. Arteria communicans posterior. Arteria communicans posterior. So these two symmetrical structures combines together, forming circle of Willis for instant blood supplying of the basis of the brain. And it's easy to imagine ourselves that all these smallest vessels practically, again, we we have enlarged this picture several times in comparison with real measurements. The smallest vessels could be damaged due to problems with blood supply, and it can lead to the stroke and paralysis of the person. So it's very serious problems, and could be serious reason for death of person. That's why we should know each details in this blood supply. And now another very important vessel, also not large, Arteria ophthalmica. We shall use the picture from Atlas of Franz Fenisch, and I hope you recognize that this is anterior fossa of the internal surface of the skull. Orbit was cutted in upper wall, for we can see the eyeball and optic nerve, and that's why these small vessels also could be seen. And now let's try colorize these vessels. First, number one is Arteria ophthalmica itself. Arteria ophthalmica, where it enters the orbit through canalis nervi optici. That means that in normal situation, Arteria ophthalmica enters the orbit together with nervus opticus. They coincide each other. And then number two, here it is, this small vessel which enters the nerve, nervus opticus, and then we can find it with dotted line because it will be pass inside of optic nerve. What is it? It's arteria centralis retina. Arteria centralis retina. Then number three. What is number three? It's small artery which leave the orbit, and we can find it on the eyelids. It's Arteria supratrochlearis. I hope you understand that this is right eye, eyeball, and right orbit, and this is also right part of the orbit. So number three is Arteria supratrochlearis. Arteria supratrochlearis. And number four, it contacts with Arteria dorsalis nasi, which anastomoses with Arteria angularis. And now number 5. Number 5, what is it? It's Arteria supraorbitalis. Number 3, supratrochlearis, and number 5, Arteria supraorbitalis. I'd like we remembering these details of anatomy here. From right side, this is foramen supraorbitalis. From left side, it's not foramen but incisura supraorbitalis. And medially to it, we can find this or foramen or incisura. Here, incisura supratrochlearis. So, supraorbitalis is more laterally, supratrochlearis is more medially located structure. For incisura supraorbitalis, and here incisura supratrochlearis. You can say that they are not symmetrical. Sure, it's very often situation, not symmetrical location of different vessels. And now, number 6. What is it? It's Arteria lacrimalis. You can recognize here glandula lacrimalis, which is located laterally inside of the orbit, and Arteria lacrimalis supplies it with arterial blood. And then number 7, here it is. It's Arteria palpebralis lateralis, which is the branch of Arteria lacrimalis. So it is branching inside of the orbit, but we can find there it's on the face. Here it is. Number 7 is Arteria palpebralis lateralis. So lateral angle of the eye is supplied by this vessel. And now, number 8. Here it is. It's ramus, which make anastomosis between arteria ophthalmica and another artery. Number 9. This artery number 9 is Arteria meningia media. Meningia media is located in middle fossa of the cerebral part of the basis cranii, and they are connected with each other through this anastomosis. And again, number 7 with dot. What is it? Arteria palpebralis medialis. Why we need to know it? Because it helps us to understand that here on the eyelid, superior and inferior eyelids, there are two anastomoses which lateral and medial palpebral arteries, which originates in the internal surface of the skull. You know, that's why this region is extremely dangerous according to different infectious processes. For example, for phlegmon, abscess, so on, so on. That's why it's extremely prohibited to do ourselves something with this region, trying to remove any small comedon or small infected lesion of the skin, because it can lead to infection of the brain. And as a result, for example, meningitis, which can develop extremely dangerous and extremely rapidly, and can lead to the death. There are some famous persons in history who died due to such kind of reasons in very young age. So we have finished with this picture, and I hope it shall help you to understand all branches of arteria ophthalmica. And now I'd like to demonstrate you another quite complicated picture from, again, Lippert anatomy of Lippert. You can make print screen and then to make pause and then print screen and print on the paper to find all the details, to understand anastomosis, numerous anastomosis between different vessels of different origin. It's very also important information. And now extremely important picture: blood supply into the brain. It's scheme where all the arterial vessels of different origin are together, and it would be good that this picture you could draw by the heart. Later we shall make this picture together, and just now only try to remember it. And now practically the same, but not schematically, but according to the atlas picture. It's from Netter, Atlas Anatomy of Frank Netter. Wonderful source. And we use it here without any designation to try understand the movement of the blood. First of all, number one, what is it? It's arcus aortae, sure. It was cutted here from aorta ascendens and here from aorta descendens. Arcus aortae. We know that from arcus aortae, 3 large vessels originate. Number 2, what is it? It's truncus brachiocephalicus. Number 3, what is it? It's arteria carotis communis sinistra. And number 3, what is it? Number 4, what is it? It's arteria subclavia sinistra. So these 3 vessels later take origination for vessel number 5, arteria subclavia dextra, and number 6, arteria carotis communis dextra. And also from left side, the analogous symmetrical vessels, arteria carotis interna and externa, dextra and sinistra. It's important that number 7 with dot, arteria carotis interna, without any branching, elevates to the Turkish saddle, and here we can find that from right and left sides they anastomosis with each other. So this is number 8 and 8 with dot is arteria cerebri anterior dextra and sinistra, and between them there is anastomosis number 9 is arteria communicans anterior, arteria communicans anterior. Then vessel number 10 is arteria cerebri media, arteria cerebri media, and then number 11, arteria communicans posterior dextra et sinistra. And now I use another color, dark red, which demonstrate the vessel number 12. Why we use another color? Because this vessel originates from arteria subclavia, another basin, and number 12 is arteria vertebralis, which passes through canalis inside of transversal process of the cervical vertebra, and they contacts with each other in the middle as number 13, arteria basilaris. Number 13 is arteria basilaris, and arteria basilaris divides into 2. Number 14, arteria cerebri posterioris dextra and sinistra. So circulus arteriosus or circulus circle of Willis is formed. Another detail, you can see that from Arteria vertebralis, two paired vessels contacts with each other in the middle and form number 15 Arteria spinalis anterior. Arteria spinalis anterior. So it was scheme, and now we can demonstrate on the spinal cord these arteria spinalis anterioris, right and left, which contacts in the middle spinal groove with each other and supplies with arterial blood the medulla spinalis from anterior side. So this is very important scheme for understanding the blood supply of the brain and spinal cord, and we shall use it in the tests, this picture also. And now I'd like to summarize that blood supply of brain have two sources. Internal carotid artery provide blood supply of anterior 2/3 of the brain. So I use the scheme of the brain, and this large red circle demonstrates that anterior 2/3 of the brain is supplied by internal carotid artery. And also there is a vertebral artery which supplies posterior 1/3 of the brain. I use another red circle which is smaller than upper to demonstrate that posterior 1/3 of the brain is supplying from the vertebral artery. So together these two sources, internal carotid artery and vertebral artery, they from both sides, left and right, communicates and provides the constant blood supply of the brain, which is crucial for our life. So it's very important material. Please know it good. Thank you.